Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, a new standard for evaluating kidney disease that's race neutral, and major recognition for research leadership in neurology. But first, preparing for the Omicron COVID variant. First detected in South Africa, it has already spread to the United States.
We've heard some anecdotal reports from South Africa that it does appear to be more transmissible than the previous circulating strains of SARS-CoV-2. And indeed, the rapid rise of cases in South Africa does speak to that, which is why the World Health Organization designated it as a variant of concern.
Scientists are already trying to determine how effective existing vaccines will be against the variant.
So they make sort of a pseudovirus in the lab and test that pseudovirus against the immune responses that humans have generated in clinical trials. In addition, we'll continue to follow adults currently enrolled in clinical trials, as well as children and other vulnerable populations, to determine if the vaccines that we have for COVID-19 continue to be effective against this variant.
Meanwhile, the School of Medicine continues genetic sequencing of positive COVID test results to identify dangerous variants in our midst.
So this instrument is called an Illumina NovaSeq 6000. This instrument works by capturing DNA that's made from the virus onto a glass flow cell that looks like this. And on this flow cell are small stretches of DNA called oligonucleotides. And then sequencing chemistry is applied to the flow cell, and we collect the data on this instrument.
Should an Omicron variant be spotted, state health officials will be alerted immediately. While more data is needed, Dr. Lawrence believes existing COVID vaccines will more than likely protect people from serious illness, hospitalization, and death.
So now, more important than ever, keep the social distancing, stay vaccinated, encourage others to be vaccinated, and then advocate for vaccine to be distributed to all parts of the world as a means to prevent transmission of COVID-19.
Research has shown that there is no biological reason for including race in the diagnosis of chronic kidney disease. That's why University of Maryland Medicine is adopting a new race-neutral assessment to evaluate kidney function. The change could improve access to care for thousands of African American people living with advanced kidney disease.
The standard is to utilize a standard laboratory test result called serum creatinine, and to incorporate, in addition, factors relating to the patient, which includes the patient's age, their gender, and for the last 15 to 20 years, the patient's race, which was categorized in the equation as only African American or non-African American. And so what we are instituting is a change in the way that glomerular filtration rate is estimated using new equations that have been developed and published and peer-reviewed that do not incorporate this term for race.
The use of race tended to estimate kidney function as better than it actually was, creating a disparity in care. In other School of Medicine news, Department of Neurology Chair Dr. Peter Crino has received the Javits Neuroscience Investigator Award, which provides $2.7 million in research funding. Awardees must have demonstrated exceptional scientific excellence and productivity in neurological research.
We work on a family of disorders that are called mTORopathies, and these are disorders that result from mutations in a family of genes linked to the mTOR signaling pathway. Clinically, these patients have epilepsy, brain malformations, autism, and intellectual disability. And so my laboratory and my two collaborators will be collaborating to work on a family of these disorders that lead to a phenotype called megalencephaly, which is an enlarged brain size, which is associated with epilepsy and autism. The idea is that as we design, for example, studies to look at the cause of these disorders, we may be able to target new therapeutics for these disorders.
Congress established the Javits Neuroscience Investigator Award in 1983 in honor of the late Senator Jacob Javits, who suffered from ALS. That's Frontline News. Thanks for joining us. We'll see you again in 2 weeks.